What's the first thing that pops into your mind when you think about truly healthy foods? For so many of us, it's those incredible, versatile eggs. We know they're packed with protein, brimming with vital nutrients. But what if I told you that for us seniors, eating eggs the wrong way could actually be doing more harm than good? I'm Dr. Benjamin Cole, and for over 6 decades, I've dedicated my life to internal medicine, especially caring for folks just like you. I'm 92 years young this year, and you can still find me seeing patients every Tuesday at a wonderful retirement home upstate. People often marvel, Dr. Cole, how do you do it? How are you still going strong? And honestly, one of my most cherished health secrets, a simple one perhaps surprisingly, is indeed the humble egg. But here's the kicker. I don't just eat them any old way. There's a specific approach I've honed over the years. Today, I'm going to share some profound insights about egg consumption, wisdom I've gathered from treating thousands of our beloved elderly patients. I bet eggs grace your table almost daily, don't they? And you probably think you're doing yourself a world of good. But are you perhaps unknowingly preparing or consuming them in a way that, despite your best intentions, is quietly undermining your health? My hope is that this story will help you uncover the truth. Please stay with me until the very end to get the full picture. And while you're here, take a moment to click that subscribe button and give this video a like. It truly helps us bring more vital health information directly to you. The hidden dangers. When good intentions go wrong. Hundreds of our senior patients visit my office every year. Many of them religiously eat eggs every day, yet their health continues to falter. Let me tell you about Mr. John Smith from Chicago, an 83-year-old gentleman, a prime example. He ended up in the hospital, desperately ill with salmonella poisoning after making soft-boiled eggs his daily morning ritual. Initially, we just thought it was a straightforward infection, but as we dug deeper, we discovered that Mr. Smith had been eating soft-boiled eggs every single morning for 40 years. And recently, in an effort to be frugal, he'd even started eating eggs past their prime. His immune system, naturally weakened by age, turned a once harmless habit into a serious, even life-threatening risk. Our bodies simply aren't the same as we age. Habits that served us well in our younger days can become unexpectedly dangerous as we get older. Eggs, in particular, are far more complex than most of us realize. They're a rich tapestry of proteins, fats, and minerals. And how these components interact with our bodies fundamentally shifts with time. In my 60-plus years as a doctor, I've observed that while eggs are undoubtedly a healthy food, they can truly be either a medicine or, frankly, a poison, depending entirely on how you prepare and consume them. And this distinction becomes even more pronounced in our golden years. Are you perhaps eating eggs daily but feeling as though your health isn't improving, or even seems to be declining? If so, then what I'm sharing today could be an absolute game changer for you. Let me share the story of Mrs. Mary Johnson, an 86-year-old from Kansas. For over 2 decades, she'd been taking cholesterol medication. Every morning, she'd eat fried eggs, convinced she was getting her much-needed protein. Yet, her cholesterol levels never budged. When she first came to me, she was on 3 different heart medications and 2 cholesterol medications. She was exhausted, weary of the constant reliance on pills, and just begged for help. When I inquired about her eating habits, she explained her routine. Fried eggs every morning for breakfast, just the egg whites at lunch, and taking her medication right alongside those eggs. That's when I taught her the specific egg-eating method I'll reveal to you shortly. Over the next 3 months, she diligently followed my advice. The result? She was able to significantly reduce her cholesterol medication. On a recent checkup, her numbers had dropped by nearly 30%. 6 months later, she reported feeling less fatigued, with her energy levels remarkably restored. All of this, just by changing how she ate her eggs. Isn't that truly amazing? You know how challenging it can be to change long-standing eating habits. But our decades of experience have shown us that even small, thoughtful adjustments can lead to monumental improvements. What I'm about to share with you today could be more impactful than any new medication or even major surgery. This information is crucial, actionable knowledge that could genuinely shape your lifelong health. To fully grasp its immense value, please watch this video until the very end. And again, a quick reminder to hit those subscribe and like buttons. Your single click can help ensure this valuable information reaches even more people. It just might help someone else live a healthy, vibrant life to 100 and beyond. Please be aware, if you don't fully understand this information or put it into practice incorrectly, you could inadvertently harm your health. So be sure to watch the entire video before making any changes. If you've been eating eggs for your health until now, it's time to learn how to truly eat them the right way. 5 egg-eating methods seniors must avoid. Here begins the main part of our discussion. Let's delve into 5 common egg-eating methods that you, as a senior, should absolutely avoid. 1. Eating only egg whites on an empty stomach. Many folks, worried about cholesterol, meticulously discard the yolk and only consume the egg white. But let me be blunt, this is a major misstep. Egg whites contain a substance called avidin, which when raw or undercooked, actively inhibits the absorption of biotin, also known as vitamin B7. A deficiency in biotin can lead to serious issues like nerve damage, persistent fatigue, and even depression. Biotin is a particularly critical vitamin as we age. It plays an essential role in maintaining a healthy nervous system, supporting skin health, and preserving our precious cognitive function. A lack of this vitamin might start subtly, with simple tiredness, but it can progressively worsen, leading to numbness in the hands and feet, muscle weakness, memory lapses, and yes, even depression. I recall Mrs. Eleanor Thompson from Maine, who developed such severe numbness in her hands and feet due to this very habit that she had trouble walking. This negative effect of avidin is significantly amplified when consumed on an empty stomach. Why? Because when your stomach is empty, there's a higher concentration of stomach acid, which ironically makes avidin even more potent. What's even more crucial to understand is that beyond just cholesterol, egg yolks are powerhouses of nutrients. Lecithin, omega-3 fatty acids, lutein, and zeaxanthin, all absolutely essential for senior health. Lecithin is vital for brain health, while lutein and zeaxanthin are remarkable for protecting against age-related macular degeneration, preserving your eyesight. You simply miss out on all these incredible benefits if you discard the yolk. The practical tip here is simple: always eat the yolk and the white together. And crucial for older adults, consume them during or after a meal, never on an empty stomach. The yolk itself is rich in biotin, which helps to counteract the avidin effect of the white. Furthermore, having a small vegetable salad or a piece of whole grain toast before your eggs helps slow down digestion and aids nutrient absorption. If you're concerned about cholesterol, aiming for about 5 to 7 eggs a week is generally considered a healthy amount for most seniors, which usually translates to about 1 egg a day. If you're currently taking cholesterol medication, please have a conversation with your doctor about your egg consumption, and, if possible, try to eat your eggs in the afternoon. Patients dealing with dementia or Parkinson's disease should be especially cautious, as their already weakened nervous systems mean a biotin deficiency could worsen their symptoms much more rapidly. Also, individuals taking certain medications, like environmental hormones or specific antibiotics, are more susceptible to biotin deficiency and need to take extra care. How have you been eating your eggs until now? Have you perhaps been discarding the yolk for your health? 2. Eating raw eggs. Some seniors cling to the habit of drinking raw eggs, sometimes even with a bit of vodka, or consuming them very soft-boiled. This, my friends, carries an incredibly high risk of salmonella infection. And remember, our immune systems weaken with age, making us far more vulnerable to infections than when we were younger. A salmonella infection in an older adult is not just a simple stomach ache. It can lead to severe dehydration, dangerously high fever, and even sepsis, a life-threatening condition that demands immediate hospitalization. Statistics from the Centers for Disease Control clearly show that deaths from salmonella infections are highest among adults 65 years of age and older. Another significant issue with raw eggs is their interference with vitamin B absorption. The avidin in raw egg whites retains 100% of its activity if it isn't heat-treated, making biotin deficiency a much greater risk. Moreover, the proteins in raw eggs can bind to beneficial bacteria in your intestines, disrupting the delicate balance of your gut microbiome. The health of your gut microbiome is profoundly important for your immunity and even your mental well-being as you age. Recent studies are even linking the balance of gut microorganisms to conditions like Alzheimer's disease, Parkinson's disease, and depression. I remember 82-year-old Mr. Mark Thompson, who ended up in the intensive care unit with severe sepsis, all because of his lifelong habit of drinking raw eggs with vodka. Even after recovering, he endured a lengthy course of antibiotics, which further disrupted his gut balance, leading to chronic diarrhea and malnutrition. For safe consumption, you absolutely must cook eggs thoroughly to at least 165 degree or 74 degree or higher. The best practice is to cook until the egg yolk is completely solidified. For boiled eggs, that means boiling for at least 9 to 12 minutes until the center is entirely hard. When purchasing eggs, always check their freshness. Avoid any eggs with cracks or stains on the shell. Once you bring them home, refrigerate them promptly and aim to eat them within 2 weeks. And please, always wash your hands thoroughly after touching eggshells. Pay extra attention to eggs nearing their expiration date or those being sold at a discount. Your health is simply not worth the bargain. While it's wise to be frugal in life, investing in fresh, properly cooked eggs for your well-being is one of the smartest choices you can make. Do you perhaps enjoy soft-boiled or raw eggs? How about making a change to fully cooked eggs, starting today? 3. Consuming eggs with medication. Many of us seniors take various medications, and this is where we need to be particularly careful. You should never consume eggs alongside certain medications. Specifically, blood thinners like warfarin, certain antibiotics, and iron supplements can have problematic interactions with eggs. Blood thinners, such as warfarin, are prescribed to prevent dangerous blood clots. The effectiveness of this medication is highly sensitive to the amount of vitamin K in your diet. Egg yolks are rich in vitamin K. Suddenly increasing or decreasing your egg consumption can drastically alter the drug's effects, potentially increasing your risk of bleeding or, conversely, blood clots. Certain antibiotics like tetracycline and quinolone can bind to the calcium, magnesium, and iron found in eggs, significantly reducing their absorption. This can weaken the antibiotic's effectiveness and delay your recovery from an infection. Taking iron supplements with eggs can also interfere with iron absorption. The protein in egg whites can bind with iron, forming a complex that isn't easily absorbed in your intestines. This is an especially critical issue for older adults who are already struggling with anemia. I recall 85-year-old Mr. Harold Smith, who was rushed to the emergency room with a brain hemorrhage because the vitamin K in the eggs he was eating daily diminished the effects of his warfarin. And 76-year-old Mrs. Dorothy Jones suffered needlessly because her anemia simply wasn't improving, despite faithfully taking her iron supplements, all because she was consuming them with eggs. For safe consumption, it's best to allow at least a 2-hour gap between eating eggs and taking your medication. If you're on particularly critical medications, extending that gap to even 4 hours can provide an extra layer of safety. Always talk to your doctor or pharmacist about any potential interactions between your specific medications and eggs. They can provide guidance tailored to your unique health needs. For example, thyroid medications like levothyroxine should, in principle, be taken on an empty stomach in the morning. If you're eating eggs in the morning, it's best to take your thyroid medication at least an hour before your eggs. High blood pressure medications and statin cholesterol medications should also be taken at least 2 hours apart from egg consumption. Additionally, eggs can interfere with the absorption of calcium or zinc. So, if you're taking these mineral supplements, be especially mindful. Calcium is vital for bone health, and zinc is crucial for your immune system. If you're supplementing, avoid taking them with eggs. Take them at a separate time. What foods do you usually take with your medication? Pause for a moment and consider if you have a habit of taking eggs at the same time as your pills. 4. Consuming eggs. Between 6 o'clock a.m. and 8 o'clock a.m. Many of us enjoy fried eggs or steamed eggs first thing in the morning. However, this particular window between 6 o'clock a.m. and 8 o'clock a.m. is when our bodies secrete the most cortisol. Cortisol itself naturally raises cholesterol levels, and when combined with eggs, your cholesterol can absolutely skyrocket. Cortisol is often called the stress hormone, but in reality, it's an essential hormone that meticulously regulates our body's daily rhythm. It naturally increases as we wake up in the morning and gradually decreases in the evening. The crucial point here is that cortisol actively promotes cholesterol synthesis in the liver. The time between 6 o'clock a.m. and 8 o'clock a.m. is when those cortisol levels are at their peak. Eating eggs during this window further stimulates cholesterol production in the liver. This effect can be even more pronounced in U.S. seniors, as our cholesterol metabolism is often not as efficient as it once was. I remember 78-year-old Mr. Ronald Jones, who tragically collapsed with an acute myocardial infarction after making fried eggs his daily 6 o'clock a.m. breakfast. Tests revealed his cholesterol levels were twice the normal level. He ate eggs every morning for his perceived health, but unknowingly, he was harming himself. Another concern with morning egg consumption is that our digestive function isn't fully active so early in the day. Our gastrointestinal tract has been resting all night and only gradually begins to function. Protein-rich eggs, while nutritious, can be a heavy burden to digest first thing. This can lead to indigestion, uncomfortable bloating, and heartburn. The optimal time to enjoy your eggs is actually between 2 o'clock p.m. and 4 o'clock p.m. This is when your body's natural cholesterol synthesis is at its lowest. Furthermore, your digestive system is fully awake and activated during these hours, allowing for more efficient nutrient absorption. Your liver activity is also at its most active, making cholesterol metabolism more efficient. Always eat your eggs with vegetables. The fiber in vegetables helps to reduce cholesterol absorption. Vegetables like broccoli, spinach, and onions are particularly fantastic pairings with eggs. Fiber helps excrete cholesterol in your intestines, and their antioxidants protect your blood vessel health. It's also wise to avoid eating eggs right before bed. Protein digestion requires a significant amount of energy, which can interfere with your quality sleep. Nighttime is when your body focuses on repair and regeneration, so it's better to prioritize rest and recovery rather than expending energy on digestion. If you need protein in the morning, consider easier to digest protein sources than eggs, such as tofu or Greek yogurt. These are high in protein, but place less burden on your digestive system, making them more suitable for breakfast. What time of day do you usually eat your eggs? If you have a habit of eating them first thing in the morning, how about trying a different time? 5. High-temperature oil cooking. Fried eggs are a beloved cooking method for many. However, cooking eggs in high-temperature oil can severely denature the protein, making it incredibly difficult to digest and potentially irritating your stomach lining. Egg protein is very sensitive to heat. Cooking at temperatures exceeding 212 degrees, 100 degrees Celsius, causes the protein structure to change, making it harder for your digestive enzymes to do their job. This significantly increases the burden on your digestive system, which can be a major problem, especially for older adults with naturally weaker gastric function. A far greater concern is the harmful substances generated during high-temperature cooking. When oil is heated beyond its smoke point, it produces dangerous compounds like aldehydes and acrolein. These substances not only directly irritate your stomach lining, but, in the long term, contribute to inflammation and increase oxidative stress throughout your body. High-temperature cooking also destroys choline, a vital nutrient found in egg yolks. Choline plays a crucial role in brain health and memory maintenance and helps slow cognitive decline in seniors. It's a tremendous loss to destroy such beneficial nutrients through improper cooking. I recall 84-year-old Mrs. Jane Smith, who suffered from chronic gastritis after eating fried eggs every single day. Her appetite dwindled and she lost weight, but her gastrointestinal symptoms dramatically improved after she changed how she cooked her eggs. At first, she simply thought it was general indigestion, but eventually, the culprit was identified as those high-temperature cooked eggs. Mr. George Smith, 82, had a similar experience. He'd loved fried eggs his entire life, but as he aged, they became increasingly difficult to digest, causing him severe heartburn. His digestive discomfort was greatly reduced, and his protein intake improved significantly after he switched his cooking method to boiling. The best way to cook eggs is to place them in cold water and slowly boil them over low heat for about 10 minutes. This minimizes protein denaturation, leading to excellent nutrient absorption and easy digestion. It's important to reduce the heat and maintain a low boil once the water starts to bubble. Continuously boiling at high heat can cause the egg protein to become excessively tough. Other excellent cooking methods include steamed eggs or poached eggs, both of which involve cooking slowly at lower temperatures. Steaming gently cooks the egg with water vapor, while poaching delicately cooks eggs in simmering water. Both methods avoid the use of oil and significantly minimize protein denaturation. Critically, avoid cooking eggs in the microwave. Rapid heating severely denatures the protein structure and frankly sometimes even poses an explosion risk. A microwave's uneven heating often overheats some parts of the egg while undercooking others, making digestion even more challenging. Using herbs or spices when cooking eggs is also a wonderful idea. Turmeric, black pepper, and parsley, for example, can promote digestion and have anti-inflammatory effects, which are highly beneficial for senior health. Turmeric in particular, with its curcumin content, reduces inflammation and is excellent for brain health. If you've been enjoying fried eggs until now, how about making the switch to boiling or steaming starting today? Your path to healthier aging, a summary and call to action. So far, I've outlined 5 egg-eating methods that you, as a senior, should consciously avoid. Let me reiterate, eggs are absolutely a wonderful food. However, if consumed incorrectly, they can, ironically, harm your health. Let's summarize these crucial points once more. 1. Do not eat only egg whites on an empty stomach. Always eat the yolk along with the white and consume them during or after a meal. 2. Avoid raw or undercooked eggs. Be sure to cook them thoroughly until the yolk is completely solid. 3. Do not eat eggs with medication. Leave at least a 2-hour gap between your eggs and your pills. 4. Do not eat eggs early in the morning. The best time for egg consumption is typically between 2:00 p.m. and 4:00 p.m. 5. Do not cook eggs in high-temperature oil. Boiling or steaming in water is your best and healthiest option. By simply following these principles when enjoying your eggs, they will transform into a truly perfect food, not only supplying essential protein, but also a wealth of other vital nutrients like vitamin D, various B vitamins, selenium, and choline. Protein intake is especially critical as we age. Protein plays countless roles, including maintaining muscle mass, strengthening your immune system, and promoting wound healing. Eggs are one of the most efficient and complete sources of this crucial protein. The very reason I'm still able to engage in my medical practice at 92 years old is precisely because I've consistently adhered to these small yet powerful principles throughout my life. Changing deeply ingrained eating habits doesn't happen overnight. However, even if you choose just one of the things you've learned today and put it into practice, it will build up day by day, creating a profound and positive change in your health. By diligently following these 5 principles alone, eggs will truly become a tonic for your well-being. Choose one small change you can implement right away. How about boiling your eggs tomorrow morning and enjoying them with some fresh vegetables at lunchtime? In our next video, I'll be sharing 5 specific foods that you absolutely should be eating as you age. Just like today, I'll be sharing actionable health tips grounded in solid medical evidence. Thank you for watching all the way to the end. Don't forget to subscribe to our channel and like this video. Make smart choices and practice them every single day on your journey to a healthy 100 years. I'm truly rooting for your healthy old age.